Okay, good morning, colleagues. Welcome on this Thursday. As we march along to our 30 years of democracy, this is a platform for us to take a step back and look at things from a different perspective, see what it is that we have done right, and what are the things that going forward we can do, more to create this one great South African nation. You are welcome to this Global Public Health Week engagement organized by PHASA. The title for our engagement today is about community engagement as a toolkit to equitable health and a means of fostering peace in South Africa. So we have a panel and a guest speaker. I'm going to ask our panelists first to introduce themselves, and once they are done, I will do the introduction of the guest speaker through going through her brief bio, and then she will indulge us on what she has prepared for us on the topic we have provided to her. So without much ado, let me invite our panelists to introduce themselves for your benefit, and then we have kickstarted. I'll start with Professor Takalani Tshitangano.
And good morning, everyone. Thank you so much, Chairperson. My name is Takalani Tshitangano. I am from the University of Venda, Faculty of Health Sciences, Department of Public Health. I'm here as a board member, PHASA board member, as well as a member of the Advocacy Committee, PHASA. Thank you.
Thank you. Our next panelist is Dr. Anam Nyembezi.
Good morning, colleagues. My name is Anam Nyembezi, and I am from the University of the Western Cape. I teach health promotion in public health, and I'm also a member of the PHASA Health Promotion Special Interest Group. Thank you.
Thank you, Dr. Anam Nyembezi. Get closer to the mic when you speak, but don't eat it. Our next one is Dr. Luando Maki.
Hi, everyone. I'm Dr. Luando Maki. I'm the president of PHASA and I'm a public health medicine specialist. And thank you for having us today. And thank you for attending.
Thank you, Dr. Maki. And the last panelist we have before we go to the main speaker is Dr. Itumeleng Ntatamala.
Thanks, Chair. Good morning, everyone. So I'm Itumeleng, and I'm an occupational medicine specialist at the University of Cape Town's Division of Occupational Medicine. I'm also a PHASA board member and deputy of the Occupational and Environmental Special Interest Group. Thanks.
No, thank you very kindly, colleagues, and we look forward to your reflections once Dr. Natasha Dukhi has taken us through her presentation. Dr. Natasha Dukhi is a senior research specialist at the Human Sciences Research Council of South Africa. She has a master's in medical science, cum laude, from the University of KwaZulu-Natal. She has worked for over a decade as a medical scientist, lecturing in human anatomy, physiology, pathophysiology, and nutrition at various universities in South Africa. In 2016, she graduated with a PhD in public health from the University of KwaZulu-Natal. Natisha is a behavioral scientist involved in interdisciplinary inclusive research. Her niche areas of expertise include nutrition, adolescent and child health, health promotion, and non-communicable diseases, with a special interest in mHealth, artificial intelligence, and gender-based violence. She has served as a PI, a co-PI, and project director on various interdisciplinary surveys. Her scientific experience and collaborations have led to various interdisciplinary research outputs. She is currently a co-chair of the South African Young Academy of Science, EXCO member of OWSD, South Africa National Charter, an ex-official board member of the Public Health Association of South Africa, which is hosting us in this engagement. And she's also a fellow of the Africa Science Leadership Program, amongst others. In 2018, She was a recipient of the Grow Brundtland Award for outstanding work in the field of public health and sustainable development. Her research contributions have afforded her an NRF rating. As of 2024, she was selected as a member of the Global Young Academy. Colleagues, I give to you Dr. Natisha Dukhi to engage with us. Over to you, Doc.
Much for that warm welcome, Chair. If I can please share my screen and get started. Please do let me know once you're able to see my screen. Can you see my screen?
We can, Doc. If just get closer to the mic, I think you're a bit faint.
Okay, sure, no problem. Is this better?
Yeah, you can try that.
Okay, I'm just going to close my camera for now, and as I lead the discussions, I want to thank you once again, and thanks to PHASA for allowing me to be the keynote speaker for today. I have for you a presentation that speaks to sustainable living and engaging communities as part of the theme for this week and specifically today. I'm hoping you can see my slides. I want to start
Yeah, we
off
can
with,
see if you can just put it on slideshow.
yeah, let me just, I've got it on slideshow. I have no idea why it isn't going to slideshow. I do have it on slideshow at the moment.
You can
see
click on the top left, Natisha, you can click from beginning.
Is this better? I've got it on the
Top left corner from beginning. Click from
Yes,
beginning.
I have it.
Just hold. Kate, Kasi, please mute. Mpota, please mute.
beginning.
And
this better? I'm not sure why it wouldn't share as a, because on my side it does show as a full screen.
maybe get out and then try again.
Sure.
And colleagues, if
Please
you're
stop sharing for a moment.
unmuted, just mute yourself. Let's just have Dr. Dukhi as the only one with those powers, because things may happen whilst you have unmuted and you are alone.
Okay, I'm going to share my screen once again.
I think, yeah, Mkangeleli, you are unmuted. Please mute. Thank you.
Is this better? On my side, it does show as a slideshow. Is this better?
It's not yet on
It's still not
slideshow.
showing.
Okay, that's weird because on my side it does show.
Just click from the beginning again, exit and click in from the beginning again.
Okay. Yeah, I've done that as well.
Please try hide slide so that you close the slides on the side.
Okay, let's do that as well. Yeah, I've tried that as well. Let's see. No. I don't know why on my side.
Can you try full screen?
I've tried full screen as well.
Okay. Okay. I think, you know, I mean, in the interest of time, I think you have to proceed now.
Yeah. Yeah, now let's proceed. Dr. Dukhi will follow.
Okay.
Take the center stage.
Let me just continue, and if it does change, it will hopefully it does. So yeah, I wanted to bring you to a presentation today that speaks to the fact of sustainable development, as well as how we engage communities in terms of collaboration. And if you, look at this, can you see the next slide? Can you see my slides actually? Doesn't seem to share. Okay. That's weird as well. Wow. Can you
Your
see my
slides are no longer projecting anymore.
Slides are gone.
Okay.
Okay. Let's try loading them again and also just send it to Takalani to just share.
Yes.
Apologies, everyone.
Just in the interest of time, just to quickly share it with her, so that maybe it needs to go from another side rather than my side.
Yes, yeah. So just send to Takalani. Sorry, everyone. We did check that it was fine before we started. I'm not sure what's happening now. Please do bear with us. Our first technical glitch this week. Takalani, please share the slide once you receive them.
I'll do, Lando.
Okay.
In the meantime, Dr. Dukhi, if you can try and get a bit much closer to your
Yes,
speaker,
I'm much
because you,
closer.
yeah, that's better now.
Okay, great. Takalani, if you could share the slides on your side, please.
They haven't arrived. They're still flying.
Sure.
Natisha, please try sharing them with many members so that if they are not delayed to arrive at me, maybe they can, quickly arrive at someone else. I'm still waiting. Still waiting. Still waiting.
I'm just wondering, Chair and Lwando, if Natisha could speak to her own slides in the meantime while we're waiting.
Yeah, I
Yes,
think
Mr.
maybe
I
Dr.
was
Dukhi, let's
hoping to go
do it
along.
that once they
Sure.
are ready with the slides, and then we can interject and link up where you are. But you may begin.
Okay, great. Thank you for that. So I think I want to speak to, as I said, the fact that today was about community and sustainable development. And so in an ideal world of what we would envision as per the UNESCO Education 2030, the ideal vision of what we would want in Africa would be a young African, a global citizen, someone who is empowered, educated, healthy, resilient, somebody who is socially responsible, autonomous decision maker, and has the capacity to reach their full potential, basically, and contribute to their development of their own communities in the country as well as the region. And if we look at the Sustainable Development Goals, as many of you are familiar with the 17 goals that we do have, you will find that when we speak to these goals, we look at in terms of the alignment. And today specifically for you, I want to talk to the alignment with adolescent health and nutrition. I see the presentation is up. Takalani, if you could move to the next slide, please. Okay, and the next one as well. Thank you. Yes, as I was saying, in terms of today, my talk will be based on the Sustainable Development Goals, especially in terms of adolescent health and nutrition. Next slide. So what was interesting enough as I began my journey as a nutritionist was that when we talk about the Sustainable Development Goals, ideally we look at it of how many indicators, are reflective of adolescent specific as well as gender specific. And it was interesting that while the Gender and Adolescence Global Evidence Research Program initiated their program, they specifically looked at adolescent indicators in terms of the SDGs, but only included those that pertain to SDG 1, 3, 4, 5, 8, and 11. Interestingly enough, next slide, please. It was UNESCO education sector that worked towards adolescent health in the SDGs, and they used a different approach, and they identified SDGs 3, 4, 5, 10, 16, and 17 that referred to adolescent health. However, if we look at the whole picture, specifically in terms of South Africa, as well as globally, we know for sure that is not the case. One of the most prominent of the SDGs that's missing would be SDG 2, where we talk about no poverty and no hunger. So that was rather interesting that, that 1 and 2 were eliminated. We don't speak about SDG 6, for example, where we talk about clean water and sanitation and the various others. So definitely it speaks to a gap in that SDGs are not, correctly being inclusive of adolescent health, especially in terms of nutrition and the nutrition space. The next slide, please. And when we speak about adolescence, we speak about this very prominent section, which is known as the second decade. And what's interesting is that there's been various definitions of adolescence, or they've been incorporated under various definitions. One of the first being that adolescence, from a WHO perspective, has been that adolescents are defined as 10 to 19 years of age. Others refer to adolescents under the youth, and the youth years globally has been referred to as a 15 to 24 age group. And in some cases, they've been referred to as young people years, which is 10 to 24. It then speaks to the fact that this is a unique group in the sense that we often miss, and especially when we talk about youth, and I've mentioned it, in one of the panel discussions, that we are eliminating the 10 to 14, and so who speaks for them? And if we, interrogate this further, we look at the 10 to 14 years is vital in the sense that's the onset of puberty. When we look at the 15 to 19, that's the honing of vocational skills. And when we look at those who are 20 years and above, there are 3 factors there: the transition to work spheres, further education, and those who are actually also initiating their own families. So we speak to something where we say there's different needs. Go on. It speaks to different needs as well as changing needs. And that the fact is that when we work with adolescents, it is imperative that we look at the age groups within what we define as adolescents based on these different as well as changing needs. So what then makes, us want to focus and hone in on adolescence? What is so special about adolescence? It's a transitional period between childhood and adulthood, a time of rapid, sorry, the slide has skipped, a time of rapid physical and psychological growth, a time in which, obviously new capacities are being developed in terms of knowledge and so forth. And also in terms of social relationships, what their expectations are, their roles and responsibilities, not only towards themselves, but also towards their own health. And adolescence is clear, it's a nutritionally vulnerable period. And why do we say so? There's an increased demand for nutrients and calories for physical growth and, changes within the body composition. And very prominent and part of the research that I've been engaged with has to do with eating habits and behaviors affecting the lifestyle, especially diet and physical activity, as well as them growing independence and a need for peer acceptance amongst their social circles and the concern with appearance. Adolescence is also a nutritionally vulnerable period due to the fact that if people are HIV positive or they have other infectious diseases, they are compromised nutritionally in that way as well. And of course, there's a higher nutrient requirement or demand if there are secondary infections, there's pregnancy as well as lactation. In undernutrition, there's also the issue of undernutrition and associated deficiencies, often originating early in life. And we know in South Africa, we're currently facing not what is called the double burden of disease or triple, but more so the quadruple disease burden, which malnutrition does heavily feature there, with a lot of the children in South Africa currently having facing stunting as well as overweight and obesity. We know that iron deficiency, anemia, and other micronutrient deficiencies are also at the foreplay at the very front. And what's interesting, if you read the Global Nutrition Report of the last year, is that not only South Africa, but all countries in Southern Africa are currently with high levels or high prevalence of anemia. Another factor is taking into consideration obesity and associated CVD risk markers. And then we look at the two risk factors, which is early pregnancy as well as an inadequate or unhealthy diet and a lifestyle. And that is inclusive also of sedentary behaviors. So why then should we invest in nutrition, adolescent nutrition specifically? There's a wealth of information around that, and we could go on speaking about it for days. But the most important, that I picked up was that we need to start with understanding that adolescence is this unique group in that they need to be, responsible for their own health-related behaviors. It's an appropriate time during this period of growth whereby there's health promotion, and I must say health education as well. Such programs need to be, well executed and documented with them. And it speaks to the relationship between behavior patterns from this defined age group, as well as common things such as obesity, cardiovascular, and other chronic disease factors. And while we might say that adolescents need to take responsibility and accountability for their nutrition and the long-term consequences of it, this can be very challenging for them if they are not directed onto the right path. And it speaks to what we want for today, is that they form part of communities. And if we are not engaging effectively with them, this presents a challenge in itself before we even attempt any sort of intervention. And obviously, over the life course, you find that in this unique group of individuals, there's a high accumulation of biological and social risk. They tend to, emulate a lot of things taken from family, from friends, from peers. And it's also, impacted by educational experiences as well as cultural influences. So they all have an intertwining and interplaying role as part of this vulnerable group. Another is that if we are wanting to influence nutrition and related behaviors, it implies that we would assume that they have some choice, and that they have access to the right food sources. But in South Africa, we know this. At a country level, we might be considered food secure. However, when we look at community and district levels, we know that people are very food insecure. And that brings up the question is that if we want to influence their nutrition-related behaviors, how are we going to go about doing that, being cognizant of the fact that most of them in impoverished areas do not have proper access to food resources. And of course, if these can be corrected over time, we know that it stems forth for a sustainable environment for them, one that they can thrive in and one that's efficient for them, and conducive for them to prosper in. I want to take you through to this article that, obviously not reading this article, but, highlighting this article that was published in 2020, not so long ago, and it spoke to the fact of giving a very broad overview of adolescent nutrition in South Africa. And it also spoke to the current policies that are in place in South Africa and which affect or directly speak to adolescents, what are not in place. And that was very interesting. And I want to highlight some of the things that I did pick up from this paper. Next slide. So some of the policies, obviously, we're not going to go into the detail of the policies, but we know that some of them do speak to adolescents in that we have what is the school feeding program. We do have some of them in terms of the school fees and the child support grant is there. And there has been policies related actioning in terms of salt reduction as such. But in terms of specific policies, it finds that, a lot of times adolescents are grouped under one of these. And I alluded to it the other day as part of one of the panels, is that previously South Africa did have very specific policies in terms of adolescents. The latest policy, however, if one has to look at, does not speak directly to adolescents, but rather it speaks to youth. And so they are very much youth focused. And so in terms of youth focus, when you look at the age that they factor or hone in on, they speak to youth that are from 15 years onwards. And again, it begs the question, what happens to adolescents and who accounts for them? And what policies will, be there for them in terms of that smaller group of 10 to 14 that is eliminated from those policies? So, further interrogating this article, it was interesting to see the research that was done, post-apartheid, and what had come up in terms of those studies that pertain to adolescent health. And interestingly, because I've been doing a lot of the research currently in KZN with regards to adolescents, I found that there was, just 2 studies. If you click again, it will bring up highlighting the first study, and then there's another study, the second one, just 2 studies from this review that were done in KZN. And as I said, it specifies to the current research that I'm doing in KZN. So I wanted to look at what has been done in KZN since post-apartheid, specifically to adolescent health. And this paper was, provided great insight to the fact that there were just 2 studies that I could find, or highlighted only 2 of these studies based on the criteria. Of course, there has been a few studies that have been done since, but they've either not been completed, they are either at initial phase, and in some cases, studies have been halted. I've spoken to colleagues who are PIs of those studies. They've been halted due to a lack of funding. So what then are the gaps? Some of the gaps, it's that there needs to be more evidence for this group, to understand various components about adolescents. And that is, we want to look at their lifestyle, specifically diet, physical activity, their multi-micronutrient status, the deficiencies that they have. And of course, looking at this over the long and short term, is very important that we address these gaps, because nothing is just a one blanket covering offering. Furthermore, in terms of the gaps, we need to look at, please continue with the slides. We need to look at, we've seen from the last surveys, and if you're familiar with the national nutrition surveys, the most current ones being the 2012, which was the SMYN, and the 2016, which was the DHS surveys, were the last surveys. And those surveys identified and demonstrated that, in South Africa, there's a poor knowledge of unhealthy foods coming from adolescents. Again, yes, we have to be mindful that they did not include the entire age groups of adolescents. But what was found was that the groups they did look at, which was the older groups, there was still a prevalence of poor knowledge levels around unhealthy food, and they were unable to differentiate between foods that were high in fat, high in sugars, as well as sugar sweetened beverages, They also couldn't differentiate between those that were high in fiber or not. And so it brings that interplay of how we deal with diet and physical activity, in adolescents as they age. And therefore it speaks to how we need to define the different age groups and why we need to do it that way instead of looking at it with a blanket covering. But at the same time, we need to be cognizant of the fact that while we are promoting that, and specifically if we're speaking about diet and physical activity, and we want to promote that in our adolescents, we need to be cognizant that while we're doing that, that we are also, there's the promotion of a healthy body weight. And it speaks twofold. One is that we know in the South African culture is that in a lot of areas that when you speak to, please go back to the slides, that when we speak to body weight, often enough in the Black African communities, we have adolescents who would readily say that they prefer to be a certain weight, and that is has to do with being overweight or slightly obese, purely because it is a way of showing affluence. And so at the same time, while we're trying to show people how to eat healthily, we have to be cognizant of these cultural factors that come into play. The other thing that I wanted to mention was that, if we are trying to also promote healthy eating and lifestyle, we have to be cognizant of the fact that, especially in girl children, preventing, that attitude towards disorders, because often enough when you visit schools, you find that some of the girls are not eating a lot. And when you do speak to them, you find that it has to do with the fact there's a lot of peer pressure. They want to look a certain way, subscribe to a certain way an actress or a role model looks like. And so during this vulnerable period, it's very important that, we consider both the cultural implications as well as looking at disorders, and that we are not throwing them into one of these pools, but rather educating them accordingly of what is important for them. And also as part of the gaps, we speak about who comes together, what are the stakeholders or role players. And in terms of the departments, we need, a lot of times they work in silos. We think we're working together as researchers as well, but we also work in silos at times. And so if we want to be working to address these gaps, especially in adolescence, we need to come together and work collaboratively. That's really important. The other is that even those studies and interventions that have taken place, there have been, there's misalignment between periods of when implementation of the study occurred or intervention occurred, the evaluation and monitoring system that takes place, and in terms of sustainability, sometimes the sustainability of such an intervention is shortfall, or sometimes there is no sustainability plan in place. And the non-sustainability of crucial intervention. Sometimes the intervention is really great. It's impactful. It speaks to the target audience. It speaks to the, the specifics of who it needs to target, what community it may be needed for, what age group it may be needed for. But as I said, there is no sustainability plan. Of course, one of the big factors we spoke about this entire week is that any type of intervention, funding seems to be a huge problem. And of course, the need for new national data. It speaks to the fact that, as I mentioned, the last data that spoke to nutrition in adolescence was the DHS 2016 and the SMYN 2012, and we are now in 2014. There's definitely a time for new data that needs to show us what is happening. We know that from smaller studies that are happening at district levels, that are happening at provincial levels, that there is a huge problem. And as I said, that double burden of stunting and overweight and obesity in our children as they transition to adolescence and then to adulthood. But how much of this and how it impacts them, we are certainly unaware of them. So it brings the question of today's session in alignment with the theme for today. How may we foster community collaborations to promote sustainable life for thriving communities? And so in answering that, I felt that it was, important that we speak to the role of communities and how do we, what is needed at the local level collaboration. Because we've heard this throughout the week about, a bottom-up approach. And so, we want something that's effective and successful, but this is also a complex process. And in order for it to succeed, there are critical elements that are required for such a collaboration. And so some of those include a clear common goal. There has to be a goal, and it has to be a unified goal. It can't be where we're wanting to do research in an impoverished area, for example, and the needs and of that community is very different from what we have envisioned as what we want to do in that area as researchers. So there needs to be a clear common goal. There needs to be a fostering of a sense of shared responsibility. And, we've alluded to this the entire week where we spoke about the bottoms-up approach of how we share responsibility and inclusivity of people in communities in the interventions that we do. And so that shared responsibility has to include, it speaks to number 3 as well, a sustainable mindset. And it also speaks to the first one, a clear common goal, is that if we're not talking to the people of communities as researchers, and including other stakeholders who are decision makers as well, and various other stakeholders, including our departments such as departments of health, departments of basic education, and various others, including sports and recreation and others, without that fostered of shared responsibility, it's impossible to, go in the direction that we are wanting for that common goal. And a sustainable mindset is imperative. If we're going to do something and we want things to change, we can't change things for the next few months or a few years and wait for things to go back to a different state. We know with the current economic crisis the country is facing post-COVID, we know that budget cuts in the country. We're going through cost containment right now in terms of treasury. All of these factors, and there's so many more that I'm not even mentioning, but we need to be cognizant of them, and that keeping in mind that when we create these interventions with communities for them to thrive, there needs to be that sustainable mindset at the top. And so there needs to be collaboration and shared knowledge as well. Going into some of these communities, they do know what they want, and it might just be that we have very similar ideas as the researchers from the outside entering those communities. However, there has to be a shared knowledge between and a collaborative effort being made on both sides. And it's important for us as the researchers coming from the outside to share that knowledge with them. Sometimes they have certain crises that they would like possible solutions for within the communities, but the knowledge is not there fully for them to understand how to go about dealing with the situation, what solutions they themselves can come up with as part of the intervention. And being realistic, beginning with simple initiatives. Nothing has to be done overnight, and nothing just works where we can just get funding overnight and have something done. It starts with simple initiatives of how we work small and take bigger leaps and strides as we go along. And sustainable practices, it's just like having the sustainable mindset, but also the sustainable practices as well, keeping in mind that if we want to do research with vulnerable communities, with impoverished communities, for example, in terms of nutrition, we speak about diet and physical activity, and we've seen this often enough. In terms of physical activity, a lot of studies are grounded where, we use a pedometer, we use an accelerometer, and I've always asked this question: what happens to that community of people after the study when the pedometer or accelerometer is taken away from them? What happens then? And so we need to think about sustainable practices. What do we have, within our means to help people, continue and work and thrive in their communities? And strength in diversity, we've also alluded to this over the week. The fact that there needs to be interdisciplinary and multidisciplinary collaboration taking place where stakeholders come together for a common goal and a common purpose. And of course, it alludes to authenticity and trust. There needs to be trust. Communities are not going to trust us if we're just there to do research and leave them and, expect them to thrive and sustain themselves without us, teaching them how to do it or, assisting them in that process. So that trust is there. Another thing is that there needs to be trust in terms of, can they trust us? But not only us, they need to be trust from the very beginning. When we start those critical conversations, there should be role players such as the communities, as well as the decision makers under one roof at speaking together. And there should be that, that equality blanket over them, and not the community members feeling like, oh, the decision makers are present, therefore we do not have a say, we'll have to go by what they want. And examples of action, it's important to show communities that you've done some form of work before, and that, we speak about responsibility and accountability on their part, but what about responsibility and accountability on ours as well as researchers? Examples of action include the fact that we need to show them that if we've done research before in these areas, did it work? Where didn't it work? And how we identified those gaps, and how we think they can help us identify, how they can help us, narrow those gaps down. And then we speak of empowerment. All this can come together, but it needs to come together with an empowering mindset at the end, to empower these people so that when we leave and the study ends, that we leave a community more empowered rather than feared we have disempowered them. And so 2 things that came to play during this week, I know that a lot of you heard about it, was advocacy and communication. Came up a lot of times in our discussions throughout this week. And, clear communication, and I'm not going to go into the A to J that I've spoken about just now, but there needs to be very clear communication with communities from the beginning. If we're not keeping them in the loop, we are not being inclusive of them. And, we're not taking also their considerations as at each step of intervention building. That could be, critical. And it could result in a crisis as well. The advocacy is very important from the very beginning again. And again, it speaks to the fact of the common goal and that shared responsibility, and how we advocate for what we want done, but also take into consideration the needs of a community, as well as some of the challenges that they are currently facing. One community differs from another, so we can't obviously roll out the same thing and expect the same answers. And so what are the barriers to community collaboration? Again, funding has come up a lot of times, often enough, we want to engage, and it's funding that forms a critical thing that cannot start or initiate a lot of the programs and the interventions that would like to be done. Resources, not only research resources, but human resource sometimes not being available. And therefore, it speaks to the fact that we need to tap into those pools of multidisciplinary, interdisciplinary people that we have. We've seen this over the last 3 days, and including today, where a whole lot of us as public health specialists come together, and even non-public health specialists have been coming together with us. And why are we still in silos? Why aren't we working together in that common denomination, as part of that pool? Awareness and advocacy, again, I'm not going to speak too detailed, but it's about, identifying that, again, the needs of the community, but also looking at what are the barriers of that community. And so in creating that awareness for them and not working at silo levels. Education and training is imperative. We've spoken to the fact, we saw with shock and horror last year that South Africa made great news when we were told that our grade 4 learners are illiterate. It was very shocking to hear about that. And so it's about looking at, if we're looking at, our communities, and especially if we work in an environment with adolescents, are we providing the kind of training and education for them? At the same time, if we're looking at a school setting, for example, in terms of training, are we looking at, how we equip teachers in the schools? What kind of training and education can we have, assist them further with in terms of the curriculum? That's very important. And then there's obviously discrimination, prejudice, and social exclusion. Yesterday, a very important topic that was delivered by a colleague was on mental health. And it speaks to the fact about stigma. And if we are working in a community where we are speaking about mental health, we know that, there's diversity even within communities. And so before we even get to talking about the topic of mental health, we need to remove those stigmas, and that, if you are doing a study, for example, in a community where there's a randomization of households, people shouldn't feel like the households that are being part of a study and where households are being visited, that those households have mental health issues, so those people are poor, or those people are, are weird. We need to eliminate those stigmas, and that happens with, education, with training happening first before we even start at the intervention phase. And of course, we spoke about governance the other day as well. Governance needs to happen with the bottom-top approach being spoken of numerous times throughout this week. And so it starts at the fact that decision makers, do rely on us to some extent of the information we provide, but sometimes policies and strategies are being, made. We say it's evidence-based, but how much of evidence-based? And so when we speak to that, we need to speak about the bottoms-up approach, starting with inclusivity at the community level, because these are people that know what is wrong and what are the barriers they face and challenges they face in their communities before we even get there. And then it speaks to poverty and socio-economic inequality. And these are two things that are part of the mission of many organizations. These are already impoverished communities. Speaking to the places that I work in, these are largely impoverished places. There's a lot of socio-economic inequalities. And so we need to be cognizant of these as we include them in the intervention phase of work. And just to speak to, the sustainable development pillars. So I know these are not pillars per se, but when we speak about the sustainable development pillars, there are three pillars, which is the economic, we speak about the social and ecological or environmental, and they can be in various ways. They can be represented as pillars, which they are aligned to each other in that way, or they could come across as these concentric circles. And the example I used here was looking at children, for example, and here we are talking about if these were adolescents in a school environment, and what would be needed, what are some of the things that we need to be considering as part of how we want to empower them, how do we want to help this community. We'd have to look at, the school curriculum and the nutritional education, especially in terms of the life orientation subject. We know this is an important subject where it's supposed to, speak to health promotion, health education from a holistic point of view. But what's really concerning is that when school learners leave the school system at the end of grade 12, this subject does not count towards points to get into a tertiary institution. So students often view the subject without much importance. Yet this is the subject that is supposed to give that holistic approach to health education and health promotion. Furthermore, we're looking at children in school in terms of health, nutrition. We need to look at what are the foods provided in school cafeterias and by the vendors. We know for a fact that often enough the vendors outside are part of the communities, and they're also trying to make an honest living. Sometimes they are not fully equipped to know what type of foods they should be selling. Often enough, it is greasy foods because they're obviously cheaper and more accessible for them to get. In terms of the school cafeterias, we know that there's also been a lot of mention in the news of the school feeding program that has run into a lot of problems in certain provinces. And so we need to look at, even during COVID, we saw this come out that children relied on school meals, and the closure of schools led to the fact that they were not given that meal. And in some households, unfortunately, the child relies on that one meal to eat so that they don't have to eat at home, and their share or portion of food can be given to another member of the household. So, it speaks to what kind of food is being given in the school cafeteria, in the school feeding system, and is there concession being made during pandemics as such? And then in terms of making, the sustainable mindset as well as sustainable practices, we speak about the school gardens as part of the health promoting schools program. And we know this if you visit a lot of the impoverished schools. If you walk into a lot of the schools, I've visited quite a few over time and found that a lot of those schools, please go back to the previous slide. A lot of those schools, the area for the food gardens is no more in existence. Even if you're looking in terms of physical activity, the play area for physical education does not exist anymore. It's either become a school parking lot or parking space, and some of the gardens are no more present. And when asked why, it was because we don't have someone to tend to the garden. We don't have, we don't have money to buy things to start up the garden. So that sustainability factor comes into play. And involvement of parents as well. We need to be involving the parents of children as well. We know it's difficult. It's not easy. I mean,
Natisha,
Hi,
we lost
Dr.
the
Dukhi.
audio.
It looks like you may have muted yourself.
hi, can you hear me?
Yeah, you can now. Thanks.
Okay.
Can proceed.
Sorry. So,
Just
yeah.
also before you move along, please let's check on the time so that you wrap up. But please proceed.
So as I was saying, in terms of the school gardens, I don't know if you heard that part, the school gardens as well as the physical education where it takes place, ideally would take place on the school grounds. But often enough, when you visit impoverished areas, I've been there over the last few months, and I've seen that a lot of spaces, the school gardens no longer exist, and the space for physical education on the ground setting is no more there. And when asked why, it was because they don't have the funds for it anymore. They don't have the funds for, the seedlings to start the gardens or to even continue with the gardens, or there's no one to man the gardens. And also physical activity is no longer being done in certain schools. And so that space is being repurposed as such. Involvement of parents is great, but as we know that it's highly challenging. I know this as well in the current studies I have, is that it's great to involve parents, and often enough we want to include them, and some are very willing and will be able to assist and participate as well in some of the activities with the children or by themselves. However, in a majority of the cases, we need to develop ideas and ways of how we use this and foster relationships with parents of children that are participants in our studies. And so that, they are crucial to integrating change at the household level. And community involvement, crucial. We need to have role models or champions. There needs to be workshops. There needs to be, a lot of things that are ongoing within the community structure to show them that, as part of the intervention, and even before we get there, that when we talk about inclusivity, that we are not just using them for data, but we are, that they are able to empower themselves, that they're able to work within the structure of an intervention and beyond, and that long-term sustainability. And the very next slide, which is almost at the end. Next slide. I'm not going to go into detail. I've spent much on the previous slide, but this shows you the sustainable development model at a greater depth and shows you how these systems come into play and need to work with each other. From a social, cultural, and political point of view, your market and value chains, your food security and agriculture comes together, as well as your environments and your ecosystems, in order to bring about and addressing, health and nutrition at a grassroots level. And lastly, I want to leave you with something in terms of today's theme and all that I've said today, is that when we speak about sustainable community development, we need to be cognizant of the fact is that what do we want to do with them, how we want to go about it, and obviously having that sustainable mindset. So I want to leave you with a quote of sustainable community development is not just a goal, but rather it's a journey as we move along. It requires ongoing effort and commitment, but the rewards are immense. Building sustainable communities can create a more just, resilient, and beautiful world for future generations. So I'm going to end there, and thank you for your time.
Thank you, Dr. Dukhi. If we were, together in one space, I would be asking the audience to clap hands, but I'm sure they know how to clap hands on their platform. So I'm inviting you colleagues to use your prompt there and the clap hands for the passionate presentation by Dr. Dukhi. So without much ado, I'm not going to try to summarize, highlight key points. We will do that towards the end. But for now, I have 4 panelists that have introduced themselves, and I want them to come to the party and provide us. It'll be a two-phased approach. They have listened and they have prepared their own presentations in response. So I'm going to invite them, starting first with Dr. Anam Nyembezi, and then I will move with the others. Your turn, Dr. Nyembezi.
Thanks, Mfundisi. I hope you can hear me now.
Loud and very clear. Nice and sweet.
Yes, thank you very much, Natisha, for the wonderful presentation, insightful presentation, and very much relevant when it comes to adolescents, especially that we know that adolescents are the largest generation, are the largest population. Therefore, it is very important for us to discuss this topic. And especially because we know from your presentation that you have shown us that young people are at risk, they are vulnerable. You mentioned nutrition, you mentioned sexual reproductive health, and they are the victims of violence. They are at risk, they are being abused. They have still teenage pregnancy, which some of it is because of the intergenerational relationships. So we really appreciate your presentation and putting relevance in terms of where it fits within the SDGs that are very important. And I think I like the idea that you came up with some solutions as well. And I think I will just add few based on what you have presented. You mentioned that we need to involve them. They need to collaborate, and I agree with you on that because they are if you look at the young people, basically, if we improve their health, we improving the next generation, because by improving their health, if you use the lifespan approach, it will mean that we are able to then improve the health of them, and even when they grow older, and it will also have some overt implication in terms of commitment for future and sustainability in their generation and their children. I mean, when you speak about nutrition and you presented how we can influence young people at schools, at universities, I can't help but to think about myself about, as a rural boy, how in the city I still find myself being able to think of doing my vegetable garden, because that's how I was raised, and that's what makes me feel comfortable to say there are certain things that I can plant and grow myself for the sustainability of the family, things that we can eat, especially in this economic situation. So I think I agree with you on that, and I think young people are very influential in terms of they can provide solutions for the policies, they can influence policies. You mentioned issues of body image, and thinking about them as being in social media, in Instagram, looking at those images and wanting to be, similar to other images that they see, and that can influence in terms of the policies, in terms of what they want to eat, and what even within their parents. They can be influencers, they can be advocates for healthy policies, healthy behaviors within the families. And also another contribution that I want to make based on your presentation is that you mentioned that adolescents can also provide some leadership skills, because you spoke about diversity, and I was thinking about intergenerational dialogues and innovations that they can bring. They can mediate in terms of what you've mentioned about issues of culture, and how they can influence their parents and other people who have these harmful behaviors. So it's very important to involve them, to include them for the sustainability of our communities. And then last point that I want to provide colleagues is that we know that young people are at the forefront of innovation and technology. So I think they can fill in the human resource gap that we all know about, that some of these policies, some of these strategies, the young people can contribute in terms of implementing innovation solutions to healthcare challenges. So they can be able to provide information in their communities about health as they get it from some of the apps, which I believe that one of the way of doing it, we should be advocating for a zero-rated public health information for youth to use and empower their communities. And though they are very familiar with technology, so they can also be the health educators, they can access information. And I think that's all that I want to contribute for now, and I will wait for later. Thanks.
Thank you, Dr. Nyembezi. Colleagues, just note that we will come back to you as the audience once the panelists have made and have had their first bite. So without much ado, let me invite Professor Takalani Tshitangano on her reflection on the presentation from Dr. Dukhi.
Thank you so much, Chairperson, and thank you, Natisha, for a well-rounded, comprehensive presentation. You really chose a very important segment of the community, which is adolescents, as well as a very important determinant, which is diet and physical activity. And so I really commend you for the way you handled it. I think it was so well-rounded that if I start now to point out what did you say and what do I add, I will spoil your presentation. What I felt was that I think I need to take another angle and add simply to say, I wish the audience to simply know that we can begin to talk about sustainable life for thriving communities without us understanding what a thriving community is. So I just want to point out that a thriving community is one way where people of all generations live healthy and fulfilled lives, where they can grow and prosper now and in the future, including our adolescents, as you have addressed. And I also want the audience to know that a thriving community is one in which the diverse population is resilient and adaptable to change, where members of the community feel safe, both at home and when moving through the community and beyond at any time, at any time of the day. And that a thriving community welcomes newcomers and treats each other with respect regardless of differences, recognizing that whilst people have differences, there is much more they have in common. And that a thriving community has a baseline of sufficient resources, including good quality, affordable housing, education, fairly rewarded, stable jobs, safe drinking water supply, adequate sanitation, clean air, accessible health services, skills development opportunities, and adequate transportation system, among other necessities. So with this understanding, what can one say about our communities? Can we say our communities are thriving? Yeah, of course, to a particular extent. Yesterday, we have had Prof. Ramnik outlining that our South African communities are not that resilient. He based his arguments on a small rural-based study, which found depressive symptoms prevalence rate of 18% and actual depression rate of 27%. It shows a little bit that our communities are really not necessarily thriving at the moment. And When we look at the Bill of Responsibilities 2008, which was released by the Department of Basic Education, which emphasizes treating people equally, fairly, with respect and dignity, I don't think that this is what we see often in households, in communities, in churches, and in workplaces, and in healthcare facilities, and schools, etc. So I think our communities at the moment are not necessarily thriving, because I don't think South Africans feel safe both at home and when they are moving through the community at any given time. And with regard to clean air, I think South Africa had the fourth highest number of deaths linked to particulate matter pollution. This highest number of deaths is compared to the whole of Africa. So based on that, I just feel, okay, yeah, South Africans are not thriving communities. And we also, when we look at the housing, we can say that, yes, government is providing housing, but recently the provision has been in a steep decline. As we compare 1998 to 1999 numbers and the numbers that have been provided in 2019 and 2020. And so we can say our communities at the moment are not thriving. But we are really very happy with the way you looked at the segment adolescents, because they are the most important. And the fact that they are the ones who are tomorrow's workforce. Thank you so much.
Thank you, Prof. We are galloping along. I'm going to now invite Dr. Lwando Maki to make his reflections. To my panelists, I also have a set of questions that I have, but we'll come to those later. But for now, Dr. Maki, your reflections on the presentation.
Thank you so much. Sorry, I'm going to just adjust this. Yeah, thanks. Thanks so much. I think, I'd like to first thank, Natisha for the excellent presentation. As always, I'm excited, especially being our chair in PHASA for the Advocacy Committee. And she's touched on a very important points here. I mean, the first one is clearly understanding that you cannot have any realistic and tangible policy without community collaboration and involvement. Effectively, that's what we're here for, to try to improve the health of our people. And that's a very important point which resonates within our actions in PHASA and generally what we want to see in policy and government. The second one is also, she touched on the reality that we live in, is that there's also needs to be clear commitment from government to actually enact what we plan. There's a lot of plans in terms of National Development Plan, guidelines, health promotion strategy for the country, but implementation is still a challenge in actually getting it happening across all the boards. And she's mentioned some points and examples of playgrounds. I mean, I'm from Cape Town, and there are still schools which do have some fields, but there's a lot of socially determined ills such as gang violence, drug abuse, teenage pregnancy, and so forth, that doesn't allow us to resonate and realize what we're trying to do in some of these policies. And this is not just only about health promotion and obesity and so forth and NCDs, but also other issues within the development of adolescents and also children and also growing up to become healthy adults. So it's quite important that we address the social determinants of health, which did come out in our presentation. And I agree with that we need to address that and educate. And also, it's not enough just to have these strategies at school level, and also within just purely communities must actually be in the home themselves. The parents must know what we're trying to do and be buy-in what we're trying to do. You can have feed programs all you want, but at the end of the day, if a child is having a full 7-color meal for breakfast from the leftovers from yesterday and not trying to have a balanced meal, will lead to obesity and other challenges. And that's the positive side. The other one is that also at the same time, you might not have enough food stability in the home itself. And you buy what's actually cheap and affordable, which is usually high energy meals. not a lot of protein and vegetables, unfortunately, and we need to have that subsidization within the market so that we can actually eat healthy. And this is not a problem of just Africa and South Africa in general. It's also quite evident in the US in terms of also the obesity levels, and might be cheaper to buy a Big Mac meal rather than actually having a healthy vegetable-based food. So it's something that has to also be bought in, what I'm leading to, which is also business. Business also has to buy in our strategy. We can have all the strategy, but it must be affordable to our people to actually get some of these nutritional, affordable food and also vegetables. The other one is also I'd like to touch on is that she didn't mention it much, but the other one is that with also enacting these strategies, we also need to hold government to actually use the funds for these programs in the correct manner, and that is corruption. There's a lot of corruption which we are challenging it, and I want us, and I'm mentioning this purposefully, that we should reflect on this as we lead up to elections, so that we can elect leaders that are responsible and hold government accountable. And that's for whatever party that you may support. I think it's something that you have to look at and have to address it. In terms of when my own last reflection on this point is that within PHASA, we're also looking at trying to work with our health promotion stick, which is chaired by Anam Nyembezi. I'd like to also thank the previous chair, Dukhi, who's done an excellent job, and we want to continue to drive some of these things within PHASA. And we do invite that. I know that some members may be joining PHASA recently, and we're going to be having an email to all our members so that they can be able to join any SIG they want to join, so that we can have all members belonging to SIG. You can be part of more than one SIG. And also to please be active in those SIGs, to make sure that it's working for you and also contributing it. A lot of skills are within our membership in PHASA, and we want them to be part of this, be part of our actions. And last one, sorry, Chair, is to also remind everyone that our activities this week are based on the building of Carthage. As you know, Carthage was a great city in Africa that unfortunately went down. And one day we built in the light of rebuilding the health of our people in Africa, so that we can reach and be great once again. It's not a Carthage of one area in Tunis, but a Carthage of Africa as a whole. Thank you. Over to you, Mabalane.
Thank you, Dr. Maki. Colleagues, we're doing well in terms of time. My panelists have been a nice panelist to have, because you are taking as much as I would like you to. The last panelist who will make a reflection is Dr. Itumeleng Tatamala. And then we will then gravitate to you, the audience, because we just don't want you to be listening. We want you to engage as well. Over to you, Dr. Tatamala.
Thanks, Chair, and thanks, Natisha, for the brilliant presentation. So for me, the nexus or the crux of what Natisha has presented is really the importance of how you cannot have sustainable communities if your foundation is shaky, if your foundation is not in place. And what clearly came through for me is that there cannot be a future for any community if you do not focus on the children, if you do not focus on the adolescent or the young people. And I'll use young people as the term throughout my reflections. And as you presented, I remembered Nelson Mandela's words around children. And it's the quote is goes around: "There's no keener revelation of a society's soul than the way it treats its children." And by extension, I'll say the way it treats its adolescents, the way it treats its young people, the way it treats its mothers and pregnant women, etc. And I think the focus on young people for me links very neatly with the idea of a prosperous future, with the idea of sustainable communities as well. The other component that I think you touched on is how the concept of, and I think that's something that we must also think about, is that the group of adolescents or the group of young people is very different, particularly with the historical context of our country. So the issue of the issue of intersectionality for me comes into play as well, that with every adolescent that we think of, or every young person that we think of, we need to also consider issues around how their own progress, how their own development may be put at a disadvantage or stagnated because of issues of race, economic class, issues of gender, disability, etc. And as we think about the future, as we think about how we support young people and adolescents for, of course, the ultimate goal of prosperous, thriving communities, as Prof. Tshitangano puts it, that we take those elements into account as well. And then finally, for me, what I really enjoyed was your reflections as well on how the research community within the public health space engages with communities. And of course, communities can be very large, and it's a term, I guess, one will have to define for themselves. But how one has to take into account issues of engagement, issues of trust, issues of sustainability as well. One of the key questions that has come out from a colleague of mine within the School of Public Health was, there are lots of communities around universities that are really form the core of some of the papers that come out, because vaccines get tested in these communities, etc. But at the end of the day, the universities, for example, would get or research centers get millions in terms of grants from different donors across the world. But what is left for the community? What does a research project, large research project, have to show at the end as a sustainable legacy that they leave in these communities? And that comment got me thinking around how, which is what we were picking up on, how we create trust between researchers and communities as well. And then finally, my reflection is on an experience that I had, and it's really, again, also links very nicely to what you presented. In some of the community engagement activities that I was and colleagues engaged in in Saldanha Bay, where there is the problem of mine dust in the air, manganese coming in, and iron ore coming in from the Northern Cape through that harbor. The air pollution, or at least the quality of the air in the area, is not the greatest. But what I found interesting is, in sitting in our engagement with young people of the area, the very first comment that came from one of the young people was, we are coming there as the academics, as the public health and environmental health experts, speaking about the issue of mine dust in the area, the health effects, etc. One of the young people just looked at us and said, "But what problem? What dust problem?" And it only struck me there that the person that spoke actually has lived all his life in this environment where there is mine dust everywhere, and the issue of pollution that is such a concern for us was not necessarily a major concern for the individual. And it obviously required one to step back a bit and realize that what you as the researcher may see as a problem might not necessarily be in the first instance a problem for the actual community itself. But of course, it then allows one to, using the elements that you've spoken about of shared responsibility, education, and beginning to show each other, both the researcher and the community, how some of the what may look as the norm, or what might look as just ordinary life, might actually have an adverse impact on healthcare, and playing that role of being able to reflect one's own knowledge and to share one's own knowledge on the community, but also, like in my instant, being able to step back and think and take in what the community itself has been experiencing. So, so thank you so much for this presentation and for being able to highlight and give an opportunity for us to reflect on how we all work together in building sustainable communities. Many thanks, Chair.
Thank you very kindly to my great panelists. You have made your points around what Dr. Dukhi has provided to us. Dr. Dukhi, keep making your notes. We'll come back to you. But for now, I want to invite the audience. Audience, don't make me the post boy. So when you have questions, you must speak about your questions yourself. Don't put them on the chat room. I want you to say what you want to say, so that we all can hear and have an interactive session. So without much ado, I'm inviting hands of people who want to make inputs as well as questions that you have for Dr. Dukhi and the panelists who have made further reflections. I'm open for business now. I want to see hands. I see none at the moment. I want you to be a naughty audience. Don't be a good audience and say everything is fine. Robert Makai, please proceed with your input. You can unmute and talk.
Yes, thanks to everyone. Am I audible?
Yes, you are audible. You can proceed.
Yes, no, it's just to say thanks to Doctor for this insightful presentation, and I think most of the points that are highlighted are a true reflection of what is happening, especially if you check the schools. You know, previously we used to have a school health team that used to go to these schools, which included all the disciplines, you know, to educate the young children in terms of you know, all these things related to this environmental health. The school nurses will be there, the nutritionist will be there. So that was something that used to happen a long time ago. But now, as environmental health practitioner, when I go to these schools to conduct these inspections, there is no longer you know, intersectoral collaboration with other disciplines to continue and to work together to ensure that we achieve these goals towards sustainable development. So yeah, that's my input.
Thank you, Mr. Makai. Any other takers, colleagues? Otherwise, we will move to the next part, which is a set of questions that I have provided to the panelists to also further reflect on this topic so that collectively we're able to get to a South Africa that will, you know, be there for our children and children's children. So let me start at the end instead of at the beginning to Dr. Itumeleng Tatamala. 30 years into the new democratic dispensation, for me, you know, the issue is transformation of society takes South Africa into the next 30 years of sustainable development. What's your reflection around that?
Thanks, Chair. So I'll really try to link it to the presentation that we had today. And what I've picked up on is, in order for us to transform society into the next 30 years, it would be important for us to really take a very hard look and reflect on where we have come. I think we have made a lot of strides. If one is to look back in the areas of, you know, health, primary health care, in the area of social development, social support. You know, the stats that Natisha shared on education, not the greatest, but I think we are seeing some progress in there. We may not, you know, maybe we will not agree in you know, areas of energy, sustainability and load shedding, etc. But I think we have to have a hard look at all the different facets of society that you know, that have contributed to where we've come from. But for me, the key thing, looking at it from a health point of view, is that we have got to think very and be very honest about the value and the intensity of which we have, or the intensity in which we have engaged in community, in which we've engaged with communities, and to think about ways in which we can truly, moving forward in the next 30 years, engage communities on how we can improve healthcare, both in the households, at street level, and broadly at a community level. How we can not only rely on the state support or government support on providing a better education itself, but how we can empower communities in themselves to, beyond just a seat on the SGB, to truly contribute to advancing and ensuring that there is quality education that that is provided for young people, for adolescents, etc. It will also be important, from what colleagues have said, to be able to hold our institutions accountable. I know there's the Office of Health Standard Compliance, there's the Ombudsman, the Public Protector, and others, but I think we have got to think beyond simply expecting that these few institutions will hold society, will hold all role players accountable, but actually thinking as communities as how do we actively participate in holding these these entities accountable, but how do you also at an individual level hold yourself accountable? It's always funny again how when one approaches issues of corruption, like my colleague Dr. Maki has said, if you were to make it very personal and talk to issues of bribes or etc., people become a little bit defensive on that front. But when it is looked out on the outside, it becomes an issue of, oh no, but government should be clean. So what I'm saying in that sense is that we also will have to individually as well look at our own individual actions, because when we all collectively try to do the right thing, of course, we can then contribute to a more prosperous next 30 years. So those are my initial reflections, and of course, issues that of a free and an open media, etc. All the other elements that support a thriving nation, I think we've got to try as best as we can to protect them as much as we can, and of course reflect very critically on how these have been contributing and how these can be strengthened as well. So we do not want to, in the next 30 years, still have Auditor General reports that have been saying the same thing about malfunctioning municipalities, for example, and nothing seems to change. Thanks.
Thank you, Dr. Ntata Mala. Thanks for that insightful look into the next 30 years. And it's a 30-year period. I would want my current 18-year-old daughter to be a 48-year-old and living in that particular world. I look forward to that world. Dr. Maki, the role of leadership in promoting sustainable life to cultivating thriving communities in South Africa. What are the building blocks for us to achieve that?
Thanks, Anam. I mean, that's always a tough question. I mean, I'm not sure why I got that one. I do lead a few things, but I think in general, I think, the leadership itself is, it's first before we can be a leader and be able to achieve those goals that were said in terms of fostering community. I mean, we need to focus on the type of leadership itself first. I think we need to have leaders that are diligent, have self-introspection, and want to serve the community and respect itself. That's the first task, that the leadership itself must be correct, must be consistent, it must be transparent, and also it must be ethical at all times, especially I touched on corruption. And then the other part in terms of that with the communities, one is to involve the community from the get-go with any projects that you're going for, and also hear what problems they have, and also hear some of the solutions that they may suggest so that they buy in terms of those strategies, in terms of what you want to implement within the community to achieve those goals in cultivating them for a better life. And also within the services, we do have examples of elements that involve the community. I found that the community health workers are quite essential. They reach parts of the community that you can never reach as a clinician or even as a policymaker. And you want to make sure that those people reach those areas. And the other one is to also ensure we have an emphasis on primary health care. Primary health care is essential. Recently, last year, the minister had the Presidential Health Summit in May last year. And one of those elements was actually having the was also having the emphasis on primary healthcare, and we need to make sure that is realized. And even with the NHI and the National Health Insurance that's coming up, is that we need to make sure that there is a clear implementation of primary healthcare. I touched on it, but it should be more fleshed out, that we can focus on it, because we cannot have community upliftment without having the services in the community. I mean, that's quite a big issue. And then the other one is that we have to have proper treatment and care of our communities themselves, and that relates to elements of the services we provide. I mean, it relates to human resources. Leadership should be better planning for human resources and have a better cadre of personnel to serve those communities. The other one is relating to resources in those hospitals or clinics themselves. You have all the different resources, whether it be those which are reusable and those which are disposable, to be used clearly and be available at the time. You can't have situations where simple presentations can become complicated and lead to more morbidity and mortality within the places. I think the other one would be sorry, can you hear me? I broke off there for a second. The other one would be relating to, can you hear me? Oh, great. And then the last one would be that with all these things that are being done, we also have to look at community leaders. Am I back? I don't know, the network seems to be breaking here. And then
yeah, you're back now.
Okay, great. And the other one is also helping, working with the NGO and nonprofit sector. We have RUJASA, which does a really great work there. A lot of rural-based communities do a lot of great work there. And then also, we also have to make sure that the district health teams and the district health system itself is reinforced, because they are in the communities itself. So essentially, it's moving towards more empowerment of the primary healthcare system and strengthening and funding there, and also making sure that it's proper. It's essentially human resources are adequate there within the ratios that are acceptable. And also the last one is to involve the community throughout. So that's how I see it, that with good leadership, that's what I think we can cultivate, the leadership. That's how you lead in terms of making sure that you have the services that are needed, and also providing the services in an acceptable and correct manner, and also making sure it's accountable and spending your budget wisely. Thank you.
Thanks, Doc. And you got that one because you're the president of PHASA. That's why it is reserved for you.
Well, I think every person within an organization is a leader themselves, and you might find that even in the board level within, I listen more than I actually talk, and I'm also allowable to be led, and we need to be not be rigid and be able to share within the expertise within a group. Thanks.
No, as the leader of leaders, we will reserve the leadership question for you. I note Mbuliso and Lillian Dudley's hands. I'm not ignoring you. Let me just finish this round with the panelists, and then I will come back to yourself. Now I'm inviting Professor Takalani Tshitangano to talk to us about how do we link sustainability to the knowledge economy to promote sustainable life for thriving communities within the context of what Dr. Dukhi spoke to us.
Thank you so much, Chairperson. I wish to start my response to that question by linking it to Natisha's presentation. She mentioned common goal. So based on the determinants of a thriving community that I mentioned before, I would say thriving communities can live sustainable life when they have sustainable development initiatives that are geared towards addressing the determinants that I spoke about. So why do we really necessarily feel there needs to be sustainable development initiatives coming from the communities themselves? So in other words, I decide to put the responsibility on the communities themselves to come up with the sustainable development initiatives to address the determinants that I mentioned, because they are the ones that are intimately connected to the natural resources, social fabric, and economic well-being of their localities. What is needed, which links sustainability to the knowledge economy is that they need to be empowered. And we all know that empowerment takes place through awareness and through capacity building for some reasons. Okay, let me show you how education and awareness in the case of sustainability of development initiatives. We are supposed to provide, as the knowledge economy, provide education and raising awareness about sustainable development principles, practices, and benefits, which are very crucial to empowering the local communities themselves in order for them to address their own thriving communities determinants. So we can do that by means of workshops and training programs, as Natisha has already alluded, and community outreach activities, in order for them to be skilled enough to participate actively in sustainable development initiatives. With regard to building their capacity, we're looking into the fact that we need to really provide them with tools, with resources, as well as training that necessary, so to enable them to necessarily take leadership roles in sustainable development initiatives. The trainings might include project management skills, financial literacy, sustainable agricultural techniques, renewable energy technologies, and other relevant skills. We also feel that when we are to link the communities themselves or sustainability to knowledge economy, collaboration and partnership, as Natisha has already alluded, is very important. Communities in this case, they really need to collaborate with tertiary institutions or institutions of higher learning, with government or non-governmental organizations, with businesses, etc., so that they can access expertise, they can access funds, and they can access resources that will enable them to implement the sustainable development initiatives of their communities. Another thing that I thought is very important is their access to information and technology. And I think local communities need this, so they need information for them to make informed decisions, and also to leverage innovative solutions through technology. And this will enable them to be able to monitor their own progress with regard to their sustainable development initiatives, and also access market opportunities. So I think them having a common goal, which is sustainable development initiatives that are geared towards addressing the determinants of a thriving community, is the way to go. Thank you so much.
I think it's really great.
Thank you, Prof. And one Bill Gates is quoted as having said that if your business is not on the internet, you're going to get out of business. And you have articulated some of those issues as we link them to sustainable development. The last input before I get to the hands that I still note is Dr. Nyembezi. For you, Dr. Nyembezi, what is the role of the youth in promoting a sustainable life for thriving communities, as per the issues that Dr. Dukhi has outlined to us?
Thanks. I would like to say that reading from the National Youth Policy 2020 to 2030, it speaks about young people represent a powerful resource for the country, provided that they are supported and enabled to become active members of society. So in that, I echo the sentiments of the previous speakers by saying that I agree with them that young people or youth should be in the leadership of the policies, the decisions, the strategies that we want to implement for the sustainability of their communities. So some of the advantages that they will bring, it's fresh ideas, new perspectives on decision making, that also include relevant information about young people's needs and interests. And also it talks about there's an importance that when we involve youth in the leadership and they become part of the decision makers, then other youth will be able to at least accept those messages, those services, because the youth was involved and it was involved in shaping them. So that will be an additional advantage for them to be part of the decision and policies that are developed. Also, as I've mentioned earlier, that they do add additional human resources as youth and as adults. So it becomes important for us to look it into that way, as others have mentioned, that they can be able to disseminate information, participate in the health information, health education, use innovative ways in terms of how they participate in building healthy communities. But also, I think two additions that I want to make. The first one is that they should be in participating in these programs in the communities. They should be regarded as co-creators. So it's very important to think about those concepts of, if we collaborate with youth, if we bring them into the leadership roles, we should also give them space to co-create. We should enable them and support them to advance their ideas and encourage them to advance their ideas and listen to their ideas. So they should be co-creators. There should be ways to allow them to be co-creators so that they can own up to the decisions that we make. So the co-leadership, the co-partnership is very important. But lastly, I think I want to mention that for the promotion of the sustainability life in the community, we should, as public health professionals, strive to build a responsible youth. So, in other words, I'm trying to say, out of the things that have been mentioned as some of the issues that youth deal with, we should be able to provide solutions and working with them to make them to be responsible youth. And we know that there are many approaches that we can use to do that. There are lots of gender transformation approaches that we can use, because we understand that some of the structural issues needs to be dealt with when it comes to these issues. And for us to build responsible youth, we should engage them, they should participate, and they should be leaders and co-creators. But I don't want to mention all the ills that they are, because some of them are not because of their decision, or it's things that they find, and they find themselves in those situations. So, but ours is to make sure that at least we now try to create a responsible youth, make them to unlearn some of the things that we might have influenced them as harmful behavior. So we should try to do that. Thanks.
Thanks. Two things for me is there's a saying that says nothing about us without us. But as you articulate that, it also needs a positive agency from the young people to take up spaces that will be enabled for them. Because the second part is, we must learn to walk and work with young people. But at the same time, they need to be active contributors to a society we all yearn to have. I'm going to allow Lillian and Mbuliso to make their comments or ask questions. And then once that they've done that, we'll come back to you, Dr. Dukhi, as we go towards wrapping up this engagement with further reflection from your end. Let me start first with Lillian, and then you'll be followed by Mbuliso.
Thank you very much, Mabalane, for the opportunity, and thanks again to PHASA for an excellent discussion. First of all, Thanks to Natisha for raising some very important points and focusing on the SDGs as a foundation for sustainable lives in communities. One of the things that has struck me, though, is that we're not making the link to local government. And as you know, local government is really the level where service delivery and community development is supposed to be happening. And we do have a process of developing integrated development plans, which is a statutory requirement for local government, in which it needs to integrate the range of services that it provides, from basic services like water, sanitation, safe environments, food safety, community development, etc. So my question is, to what extent are we as public health advocates and role players engaging with the IDPs of local government or supporting communities to engage to ensure that the basic foundations for health are being addressed? I think one of the challenges we've experienced in the national health system over the last 30 years is that health was largely removed from local government. The only element remaining was environmental health. And therefore, many public health role players are no longer based within local government. And we seem to have lost that connection. So, the question, and maybe just a reminder and to flag that as an important area for engagement if we are talking about sustainable lives and the SDGs. Thank you.
Thank you, Lilian. Buliso? You have not unmuted. You can unmute.
Sorry. Yes, thank you so much for the opportunity that is given to us to intervene in this big platform. We are starting by congratulating the speakers and on the panelists for their brilliant intervention that we just had. I want to go straight to my question. As a Dr. Itumele was saying that the young people are very different. So in those young people, we are having a large number of ladies. And in those ladies, we are having pregnant women who are the ladies who got pregnant because they went for early marriages. The other one because they were raped. The other one because they were forced to be married. And the other one because they were dropped out from the school, and then they went to prostitution and they finished to get pregnant. So my worry is, my question is, are we putting all of them together when we are talking about young people, or there is a specific model that is planned to attend to those people as far as the thriving of communities, sustainability of the community is concerned? I don't know if that is what is my worry. Thank you.
Thanks, Buliso, Mono. So, Dr. Dukhi, we listened, you listened. We are now open for you to do further reflections and answer some of the questions that may have come through the inputs that have been made by the colleagues. Over to you, Dr. Dukhi.
Thanks so much, Chair. So I think, let me answer the audience questions. They were good questions, and I think these are things that, we need the continuous conversations for. I'm going to speak to Lillian's question first, and then Imboliso's question. I think in terms of the integration development plan, it's interesting that, they do exist. And, we need to highlight that, the successes as well as the challenges we are facing as we strive towards getting these sustainable and collaborative communities. What's interesting, I'm just sharing the experiences of some of the work I've been doing, is that these integrated plans do exist. And it's great to see further development. And to go back, until a few years ago, we've been post-apartheid for how many decades now? But unfortunately, the integrated development plans, spoke a lot to they were all over the place. And as Lillian correctly pointed out, the public health personnel were removed from that structure. You could see it was greatly missing. I reviewed one of the integrated development plans recently in an area that I'm working with in KZN, and it's happy to see that there has been restructuring and there's a more comprehensive integrated plan, in this district, for example, in KZN. It has nutrition components, it has water and sanitation components. It speaks to a lot of components. But again, it comes back to what's great on paper. Is it going to be the very same in the executioning of what is being done in those communities? And so I would be greatly interested to see what will be done in those communities going forward as I work with them. Because now that I'm aware of the plan and, I know those structures are there, for me, it would be interesting, and it would be also very, it will become enabling if they are actually in place and functioning, because it just makes not only the research greater, but it also, makes the environment for the community participation to be more, efficient. And so those IDPs are there in some districts, but the rollout is more important. I think that over the next few years, one of the tasks that I've given my team and myself is that, especially in the communities that we work with, is to see that these great plans are now surfacing. But how do we take what is on paper and put them into action? What are the gaps? What are these gaps from, the previous times when the old IDPs were in existence? Is there a continuous phase of things being on paper but not going through to implementation? Or if there's changes which we would really want and appreciate, if these changes are there, then it's certainly, telling us that we are on track to getting somewhere ahead and in a great way towards those thriving communities that we want to aim for. In terms of the next question, to answer that, I think, again, very great question, speaks to the fact that, are we putting everybody, again, it's something we alluded to from day one of these sessions earlier in the week. Are we putting everybody under the same umbrella in terms of these young girls that, Mbuliso spoke about? And again, we need to look at what, strategies, what policies are in place, what IDPs are in place, what, that support, are supportive of these communities. And I think we need to look at these things, more in depth, and we need to be targeted. And I think that's the, one of the roles that the IDP will also play. If we want interventions, we need to target them. They need to be targeted interventions that are context specific, that are age specific, and that are also situation specific in how we deal with them. Because if we're going to blanket everybody under the same umbrella, it's going to cause a lot of disruption and chaos, and we're not going to move forward from where we currently are now, especially with teenage pregnancy. I know a while back we had, I'm sure most of you are familiar with the Mom Connect that has been very successful largely. And in 2018, the HSRC came up with developing Teen Mom Connect, because they saw that young women, a lot of the participants were from, older women, and young women that were pregnant were not participating. And so we did, a situational analysis at first to look at why weren't they participating. And, it was horrific to hear. And it alludes to what Mbuliso is asking us, is that, what came out of those contextual analysis was that young women did not see the services, healthcare services, being fair and just. They felt that the services, healthcare services, they were very biased. They were very much. There was a lot of stigmatization involved. There was social exclusion for them, And so they felt that they, while pregnant, they didn't even want to seek healthcare services, or even when they just found out that they were pregnant, nor did they seek these healthcare services post-pregnancy. And so it comes back to answering his question, and is that we blanket everybody in the same way, in the same context, in the same circumstances, in the same consequences. We are putting ourselves at a great disadvantage, and we need to move away from that. Everything should be context specific. And yes, people may, say it's a lot of more work. Yeah, yes, in the bigger realm of things, it's going to be a lot of more work, especially for us from the public health sphere, those of us who are researchers, scientists in that sphere. It is a lot more work, but it's not work that we are all doing at any given day at all the time. There needs to be shared responsibility again. If we're talking about shared responsibility for communities, we need to talk about shared responsibilities as ourselves. We are all experts in our own fields. And I think that we have enough challenges that, we can tackle, but it's how we go about tackling it, and to be cognizant of what is on the ground happening. And again, it speaks to that inclusivity and getting information on the ground. These women that are, that Beliso spoke about, being raped or being forced into marriages, young children, Ukutwala is very present in KZN and Eastern Cape. What are we doing about that in those forced marriage situations where girls are being married off as young as 8 years old? Are there policies to support? What are we doing at the grassroots level? In terms of the IDP as well, what mechanisms are in place? Are there any structures already existing that are in place? How well have they worked? What have been the challenges been? What have been the gaps? So I think it's, it's all about context. It's all about specificity, and that it alludes to from day one what we said. Every time there's a situation and we want to, counter that situation in terms of an intervention, in whatever form it may be, we need to be cognizant that everything cannot be steered under one umbrella, that we need to identify individual challenges. We need to look at the landscape of that challenge and how we address that challenge, and not just assume that because they're coming from one community or one age group, that it allows us to just use a blanket covering mechanism. That would be a great detriment, not only to civil society, but it'd be a great detriment into how we practice as public health practitioners. And then just very quickly to give a background to what everyone has said, I think, enough has been said. I don't want to reiterate things. Just to very quickly touch on one thing, which I stayed away from, the political aspect, and if we go into that, I think we'd be here the whole day as well. It's just that, yes, political interplay, has a great place at hand. And I think it's, it's so important for us to look at those aspects. And he spoke to the last slide, second last slide, which look at social justice and, political, political interface. And so in this, we have to be cognizant that while we speak about governance, while we speak about responsibility in our aim for thriving communities and collaborative communities, we need to be aware of what is happening on the ground. And we need to be aware, there's no way beat around the bush as such about what's happening in South Africa. A lot has gone on into the school feeding system. We know a lot of problems are still existing, especially in KZN. And, as we go into the political framework of, as we go into May and the elections, we need to be cognizant of the fact is everybody's going to be screaming out aloud that, yes, vote for me. But are they looking at what's happening around? Our children are starving in some provinces. They rely on that meal and there's no food for them. And that's a whole different story. We could go into the context. I've dealt with it from 2014 of the food system and why children are actually refusing the food at schools. And that's a whole different discussion. But it goes back to, whatever's on paper and whatever we need still to be done and implemented. They need to speak to each other. We can't go on in this frame of having policies and having strategies if there's no proper action, and context-specific action, age-appropriate action, is very important. So I'm going to leave it at that. Thank you.
Thank you, Dr. Dukhi, and the audience. I think, from your first slides, which was speaking to a young African who, has a number of benefits that they should be enjoying based on the sustainable development goals that you have mentioned. We have a responsibility to invest in that young African through the issues that you have raised in terms of their nutrition, issues that the government has to play as society, as leaders. The panelists have also, added a number of layers into what you have presented. We have enough and adequate for us in the spaces that we occupy to champion the issues that we have, advanced here. You are in the academic space, and we want to see those articles written and also, broken down into small bits and pieces for community members to understand and act on those particular issues. So you have said a mouthful. We are very happy that we have had this engagement. We're happy to PHASA for having brought us together. It's been a long week for PHASA, but just one day for us who are here, and they continue tomorrow. We will watch your social media spaces. We will look at your websites to learn and to advance the knowledge that is being generated for us to build a South Africa that we want to see in the next 30 years. For now, let's relish in the journey we have traveled over the past 30 years, having done the best we can where we are with what we have. We are one nation, we need each other. So with that being said, colleagues, thank you very kindly. Thank you, Dr. Dukhi. Thank you, the panelists. You have been a good audience as well, the members who came here for the 2 hours. We started on a little bit of a hitch, but we went on to conquer this mountain. With that being said, thank you very kindly, colleagues. Our engagement comes to an end here. Thank you. Mabalane Mfundisi is my name, and I'm happy to have been your chairperson for this session. We can all move out with our hands clapped. Siyabonga.
Thank you.
Thank you,
Thank
Ryan.
you.
Thank you.
Thank you. Bye.